Hello, my name is Giacomo Vivanti. I'm a psychologist and a researcher at the Olga Tennyson Autism Research Center and the Victorian Autism Specific Early Learning and Care Center here at La Trobe University. And today I want to share with you some of our recent research on how children with autism learn and how we can improve their learning outcomes using innovative treatment approaches. Now, autism is a very puzzling disorder. Unlike typically developing children, children affected by autism are more inclined to engage in activities that involve objects rather than activities that involve people. However, people with autism often have exceptional talents. For example, this is a drawing by a person with autism, and you can notice the perfection of the proportions, the attention to the details. This is just a detail of the drawing that you saw before. But then when we look at the adult outcomes of individuals with autism, we find that, very sadly, autism affects the ability to live an adult, independent life, perhaps more than any other neurodevelopmental disorder. In fact, many individuals with autism fail to learn the communication skills, the socialization skills, and the daily living skills that are necessary to live independently, to find and maintain a job, to have friends, and to have a social life. So our question when we started this research program was very simple. How do we change that? Given the potential that individuals with autism have, there must be a way to change that. The first step was really to understand why is it difficult for children with autism to learn things. And our initial hypothesis was that difficulties in doing things by themselves that we see in adults with autism might be related to difficulties in doing things with others when children with autism are very young. And so we looked at very early learning processes and we focused on imitation. Imitation is a very important learning tool. Spontaneous imitation promotes a sense of social, emotional affiliations with other people. When we imitate others, we feel a bond with the person we're imitating. And it's a very important tool to learn new knowledge. And it starts very early in development. And what we found is that what is distinctive about young children with autism is a diminished inclination to imitate others. They can imitate others on demand, but they don't imitate others very often spontaneously. So they have the ability, but they don't have a spontaneous propensity to imitate other people. We also found other factors that were found to negatively impact learning, including a low inclination for functional play. Again, not the ability, but a spontaneous propensity to do so. So the next question was, if we increase the spontaneous motivation to imitate others and to play, is this going to improve their learning outcomes? Within the group of children with autism that we studied, we found that children who were imitating more often, they were doing better in terms of their learning outcomes. So maybe if we increase this spontaneous motivation or inclination to imitate and play, this is going to affect their learning abilities and their learning outcomes. The next question was, how do we do that in the first place? Now, one treatment approach that seemed to be very relevant to these early learning processes, which we have identified, it's called the Early Start Denver model, and it was developed in the United States by Sally Rogers and her colleagues at the University of California, where I used to do my postdoc. This program is based on fostering spontaneous imitation and play skills, as well as communication and other skills. What is interesting about this model is that it's about spontaneous play, spontaneous communication, spontaneous imitation. So in this approach, you don't tell the child what to do. You follow the child's lead, and you build learning opportunities based on the child's motivation and spontaneous inclinations. So it seemed to be ideal to target these early difficulties. However, this program, the way it's described in this paper, involved very intensive individual one-to-one home treatment by trained clinicians. So it's effective but it's not feasible, it's not sustainable. You can't do it to many children with autism. And so our big, fat, and crazy idea was to turn this treatment approach into a childcare program. Most children with ASD, which is autism spectrum disorder, in Australia are enrolled in childcare programs. So we thought maybe we can train regular childcare teachers and staff, and we can implement this treatment approach into community childcares. So we trained a group of teachers, regular childcare teachers in this model. We incorporated the results of our research so that the knowledge from our research about the mechanisms that seem to prevent learning was part of the curricular activities. And we enrolled a group of 30 preschoolers with an autism spectrum disorder in this program. As you can see in this picture, rather than a one-to-one model, which was what was used in the original study, we adapted this approach to the resources available in a typical childcare setting to make it feasible, to make it sustainable. Now, when we started this program, the majority of the children enrolled did not have any language or communication and would not imitate others spontaneously and would not engage in peer play. Like this girl, Vanessa, that's not her real name, who was enrolled in the program when she was only 18 months old. We followed these children for 1 year. And after 1 year, we compared the outcomes of these 30 children to the outcomes of 30 peers with autism who had the same age, received the same amount of treatment, but it was a generic intervention program. It was not based on following the child's lead or increasing spontaneous motivation or spontaneous inclination to imitate, play, and communicate. And what you can see in this picture, if you look at the top table, what you see is their cognitive level at the beginning of the treatment. The two groups were very similar, but then in the group enrolled in our program at La Trobe, children had improvements in their cognitive level, which was twice as much as the children in the control group. Similar in the bottom graph, you see their receptive language level, their ability to understand other people's communication, which is a key factor in cognitive development. We found that, again, the two groups were very similar at the beginning, but after 1 year of receiving our program, children enrolled in our program at La Trobe improved twice as much as the children in the control group. And in this slide, you can also see Vanessa now. In this picture, we're having a conversation where she's telling me about how she celebrated her birthday with her friends, and her language and cognitive level now is in the normal range, is indistinguishable from that of a typically developing child. Now, what is the next step? The next step is to support dissemination of this program across a range of preschool settings, including mainstream childcare programs, so that children with autism across the country can learn from their typically developing peers in mainstream childcare settings that are already available, that are already there, so that they can express their full potential. We really want to aim high for these children. Thank you for listening.